Reviewing of my performance, I believe I was very clear in instruction and gave plenty of examples on how to perform the exercises and what specific cues to take into consideration in order to get the right muscles to work effectively with the target exercises. Due to the hip pain of the client in the second set of the burpees, I thought I might change the exercise to allow a similar benefit as the client was experiencing pain. In according to her goals, I try to keep it quite similar and change the burpees to star jumps. I did have to judge the number of reps and changed it accordingly to her ability, which seemed more than expected, ramping the reps to around 15. However, due to it being my client's first session, I didn't believe it was necessary to increase the weight, as it's the start of an exercise regime. Due to an exercise machine being occupied at the time, I also had to adjust the program accordingly, taking into consideration the aim of the client's goals and how she was feeling during the session. I targeted more of the legs and took out one exercise of the arms in doing so, as the machine was occupied. I constantly asked how the client was feeling, which allowed me to either increase the reps, which I did as the client wasn't struggling too much, and it also allowed me to monitor any pain in relation to hip arthritis. Overall, I believe I conducted myself professionally and I took the session to the best possible benefit of the client and her goals. However, looking back on the session, I believe I could do more cardio, which I believe will help the client in reaching her goal of losing weight and improving fitness. If my client informed me that they smoke on a regular basis, I cannot tell her nor direct the client into quitting smoking. However, I could advise that if she wishes to get help from myself and wishes to pursue her goals and undertake training, that she must contact her healthcare professionals or limit smoking, as an increased exercise may cause health problems to the individual. Forms may need to be signed in order for her to know the health risks and cover my back as a personal trainer. The client has now begun to present the following blood pressure of 152/97. What are your required next steps? This blood pressure is too high and is considered hypertension stage 1. The primary case is due to a person's diet or obesity or developed from high sodium intake. A secondary case may come from medication or development and can develop because of heart, liver, kidney disease. Diabetes may also play a role. Doctors will want to control or reduce the patient's hypertension before it becomes a case of stage 2 or a hypertensive crisis. Medical specialists may use a variety of methods to treat a person with stage 1 hypertension, and they might implement a dietary plan also. Therefore, the client must contact healthcare professionals and gain clearance for further exercise.